The AWARE Project's aim is to balance the public conversation about psychedelics, spread accurate information, and give a new face to psychedelia. We feel that this change will occur through connection and relationship, one individual at a time. We are calling on everyone whose lives have been improved through the mindful use of psychedelics to educate themselves and become ambassadors for the psychedelic experience. Show those around you that people who use psychedelics mindfully cross all social, racial, economic, and political boundaries.
All right, so I'm going to read Ben's bio right now. Really thrilled to have Ben here. We've been friends for a while, and it's just a thrill to have him come up and finally give a talk here. So Dr. Ben Malcolm earned a Bachelor's of Science in Pharmacology from the University of California at Santa Barbara before deciding to pursue his doctorate of pharmacy at Touro University, California. While at Touro, he additionally attained a master's degree in public health. After graduation, he completed postdoctoral residency training programs in acute care at Scripps Mercy Hospital and psychiatric pharmacy at the University of California in San Diego. He currently serves as assistant professor of pharmacy practice at Western University of Health and Sciences, where he teaches psychopharmacology and the clinical use of psychiatric medications. His primary research interest is in psychedelic-assisted therapies for the treatment of psychiatric morbidity. So with that, I'm thrilled to have Ben here. Come on up.
Is this good? All right. Two things in my hands. All right. Guess I'll flick with this one. Ladies and gentlemen, boys and girls, esteemed colleagues, friends, psychonauts and ayahuasqueros, thank you so much for being here tonight. It's such an honor to speak with all of you. We've got a lot of familiar faces here supporting me, and I thank you so much for your presence, and for the unfamiliar faces, welcome, and I'm so happy to be giving this talk tonight. So, as Ashley mentioned, I do have kind of a background in traditional pharmacy. I got interested in psychedelic drugs when I was about 16 years old. Had a first experience around the age of 17 or 18, and really along this entire educational career path that Ashley just went through. I'm not going to reiterate that. This has always been important to me. And it kind of got to the end of pharmacy school, and I tried a lot of different things in a lot of different places, and still what was the most interesting thing to me was what got me interested in drugs or pharmacy in the first place, which was using psychedelic drugs. And I'm interested in the mental health population. I'm interested in helping people that are struggling psychologically, and I really see these as the most powerful and promising tools for doing that. Of course, you don't have to be ill to benefit from a psychedelic. There's a lot of benefit for psychospiritual well-being, but as a pharmacist, I have to put my pharmacist hat on for a moment and say that, in general, people think a lot of different things about pharmacy, and it's definitely true that there's a lot of different types of pharmacists out there, and I'm an oddball, I'm an anomaly. There's not too many pharmacists that are out there that are really trying to bring psychedelics to the mainstream for the treatment of psychiatric illness. But I'm really similar to other pharmacists in that we care about two things, really. We care about safety and we care about efficacy. But really the first thing that we care about is safety. So tonight we're going to be talking a lot about safety, and ayahuasca actually is an extremely safe medicine when it's used appropriately, and we're going to walk through what I think is appropriate. So before we get into it, I have a little quote here. I mean, the title of the talk, Spiritual Pharmacology, is almost provocative, because how can spiritual and pharmacology really exist in the same sentence with the same title to a talk? So our friend Carl Sagan says that science is not only compatible with spirituality, it is a profound source of spirituality. When we recognize our place in an immensity of light years and in the passage of the ages, when we grasp the intricacy, the beauty, the subtlety of life, and then that soaring feeling, that sense of elation and humility combined is surely spiritual. The notion that science and spirituality are somehow mutually exclusive does does a disservice to both. And I think this is the philosophy that I'm coming from my scientific background, and why I appreciate so much of you that come from perhaps a more spiritual perspective. So a couple disclosures. I don't have any conflicts of interest to disclose. I don't get paid by pharmaceutical companies. I also don't serve ayahuasca to people, so I don't really have a way of directly profiting fiscally from giving a talk like this. It's not really intended to be medical advice, so please don't replace the advice of your doctor or physician with this talk. That being said, if you do want an individualized consultation about this, we can make it medical advice, but not in a public talk type of setting. And then, this isn't an endorsement of illicit activity either. So, where are we going tonight? Well, we've got 3 strong objectives for you guys. Describe what is known regarding ayahuasca's pharmacology. We're going to outline adverse food and drug combinations with ayahuasca, and then more importantly, what are the strategies for managing the risk, right? Like, everything has a risk to it, but, how do we manage the risk? Like, how do we make it safe? Driving a car here is probably an extremely risky thing, but, oh, well, you stayed on the right-hand side of the road, there was an airbag, there was some stop signs and red lights, and everyone got here safely. So, we do risky things all the time, it's just about making them safe. So, lastly, I wanted to provide an overview of spiritual pharmacology and then some of the kind of current clinical data supporting ayahuasca for the treatment of mental illness. All right, pharmacology terms. So there's a couple things in tonight's presentation that are going to kind of come up over and over again. So I think it would be nice to kind of review what I'm talking about ahead of time to kind of orient you a little bit. The first thing is a drug. And in our society, drug can mean a lot of different things to a lot of different people. It can have a very negative connotation to it. From the perspective of pharmacology, a drug is just really any substance or medicine. So I don't really mean to offend anyone if I call ayahuasca or madre a drug tonight, but it may happen, so apologies. Next. Okay, the second is bioavailability. And this is the amount of drug that enters the body and is available to have an effect. So this is, it depends on how much of the drug you take, right? Like, some of it gets absorbed, but I think importantly for this talk, it's about metabolism, but it's also about the route of administration, because N-N-DMT or dimethyltryptamine can be smoked, it can be injected, or it can be ingested in a combination with the vine with ayahuasca, and it's a very, very different effect whether you smoke it or inject it versus, taking it in the form of ayahuasca. I mean, again, you can probably take a little bit of amphetamine and it might help you study or focus, but if you take a lot of amphetamine or smoke amphetamine, you're probably going to be up for days tweaking and paranoid. So, how we take drugs and how much of the drug we take definitely makes a difference, and this is what I'm talking about with bioavailability. Half-life is another really important concept for tonight's talk, and it's defined as the amount of time it takes the body to metabolize or eliminate 50% of a drug. So the example here, the drug's got a half-life of 2 hours. So you take the drug, 2 hours later, half of it is left. 2 more hours later, half of the half is left. So there's 25% left at that point. 6 hours later, so 3 half-lives now, there's 12.5% left. So the kind of rule of thumb here is about 4 or 5 times the drug's half-life. You can pretty much consider it gone from the body from a kind of physiological perspective. Now, the effects of a drug may last beyond when a drug is actually metabolized, but when we're talking about risk of drug interactions, the 4 to 5 half-life rule is a pretty good one to stick by because it really predicts how much of the drug is left around. So if you think about it, at 8 hours here, so that's 4 half-lives, we have 6% of the drug left. At 5 half-lives, it'll be about 3% of the drug left. So it's kind of thought at that point that, yeah, there's still a little bit in your system, but it's not really enough to physiologically do anything or necessarily be dangerous. There are some sorts of exceptions here. Some drugs get metabolized to other things that are also active. So drugs that have active metabolites could be an exception. And when I say half-life, you can Google the half-life of any drug. I mean, you can, whatever, my SSRI or something, what's the half-life of it, and it'll show you the half-life, but what it's telling you is a population average. And population averages don't really tell you so much about individuals sometimes. So there could be some variability in individual metabolism that kind of breaks the rules a little bit. But overall, it's usually a fairly good approximation of how long something's going to stick around inside your body. Okay, so metabolism and interaction potential. What's in ayahuasca? I think I'm going to go quickly through this because I think probably most of you guys know this stuff. But it's a combination of at least 2 plants, right? There's probably a lot more plants in certain brews. But the Banisteriopsis coopi, or the coopi vine, provides the harmyl alkaloids or beta carbolines. We're going to kind of talk a little bit more about what those are and what those do. But if you kind of look at our picture over here, kind of the brown, barky, viney looking stuff, that would be the coopi vine. And then you have Psychotria viridis. This is commonly known as chacruna. So these are the chacruna leaves here. And then there's another plant here. I'm not sure what the common name is, but it's I'm going to go with Diploteris caprana. And these two provide the N-N-Dimethyltryptamine. You brew them together in a concentrated decoction. So basically you put these plants together in a pot with some water, boil it down, add more water, boil it down, do that a few times, and then you end up with this super thick brew that we know as ayahuasca. Shamans could add some other plants to it. For example, Toei is one that you kind of read about sometimes. People adding things to brews. This is like a scopolamine containing plant. It's also hallucinogenic. Some of you may have heard like Amanita muscaria mushroom. So it's like a very anticholinergic type of a compound, the Toei. And the stories are that it increases the potency, maybe it increases the risk, but maybe it increases the healing potential too. And I don't really have a lot of data or anything to really stand upon. I don't believe that I've had any experience with Toei. So these are kind of a breakdown of what's in here. So you've got these harmyl alkaloids or beta carbolines. These are the ones on the top here. So harmine, harmaline, and tetrahydroharmine are the 3 most common. There's probably a couple others in there as well. And then N-N-Dimethyltryptamine, again, the chacruna leaves, and this is N-N-Dimethyltryptamine here. What you see though, for comparison, is serotonin. So serotonin is an endogenous or naturally made neurotransmitter in your brain, and wow, do these things look really similar. So you have just a couple of extra CH3 or methyl groups on this nitrogen molecule here, and then serotonin has an extra hydroxyl group here. I think it would be okay, hopefully, if we can keep kind of the questions towards the end, because I do want to get through it, and then, yeah. I should have said that at the beginning, I think. All right. So what's the first one? N-N-Dimethyltryptamine. This is our entheogen, so this is what we normally think about as being the most psychoactive substance in ayahuasca. Again, it's related to serotonin structurally. It occurs in the natural world really frequently. It's in a lot of things. And important for this talk is the metabolism of dimethyltryptamine. So it's metabolized by this enzyme called monoamine oxidase. And when I say enzyme, I just mean it's a little protein machine in your body that serves some type of metabolic function. And this one's function is to break down neurotransmitters as well as dimethyltryptamine. So going back to this concept of bioavailability, if you just take dimethyltryptamine in my mouth, nothing's going to happen. Your monoamine oxidase will break it down and it won't have a psychoactive effect. So that's kind of why we need to combine it with the coopi vine to get an effect in ayahuasca. So again, kind of going back to our routes here, right? So smoked or injected DMT comes on extremely quickly, within seconds, peaks pretty short, 3 to 5 minutes, and then the duration 10 to 30 minutes. So if we look at our half-life here, it's about 3 minutes. So 4 to 5 half-lives would be 12 to 15 minutes, and it correlates with the duration of the experience roughly pretty well. And then oral ayahuasca, kind of similar, right? The onset's a little slower. It's an oral or by mouth type of brew. Peak 60 to 120, duration 4 to 6 hours, and the half-life 1 hour. So again, 4 to 5 half-lives, 4 to 6 hours. So it's actually it tends to predict the duration of the most intense part of your experience pretty well. So going back to that enzyme, monoamine oxidase, it has a couple different functions in your body, so it's probably a natural defense type of enzyme or cellular machine that kind of breaks things down. It's found in the small intestine and liver, and this is where your body kind of positions things when it wants to defend, because you eat something by mouth, and that's kind of the first place it will go, and we'll see that in the next slide. And then it regulates neurotransmission, so serotonin, norepinephrine, and dopamine, it'll break those down inside your body. And this is happening both in your periphery, so in your kind of blood vessels, and it's also happening in your brain, centrally in your neurons. So why is the caffeine vine necessary? Well, if I haven't given it away yet, it's because it makes DMT bioavailable by mouth. I said, if you take DMT by mouth, nothing's going to happen unless you combine it with something like a monoamine oxidase inhibitor that is found in these coffee vines. One thing that I think maybe doesn't get enough attention is that the hormonal alkaloids themselves are psychoactive. They're not necessarily very psychedelically psychoactive, but they are psychoactive compounds and probably provide some kind of color or flavor to the experience that wouldn't be present with just DMT if you could make it bioavailable by mouth somehow without using the vine. So the liver is positioned as the body's natural defense mechanism. We have something called the first pass effect, where it's basically your body is so smart, is you eat something by mouth, and it goes here, and before it gives it to the rest of your body, it wants to check it out and see, like, is this a toxin? So the first thing it does is send it to the liver for metabolism. And that's kind of, a lot of drugs get actually taken out of your circulation before they can even get there, because the liver is such a good defender of the body from a metabolic perspective. So to kind of walk us through here, wow, I'm really loud. We have our man, he drinks a cup of ayahuasca, and it goes down into his stomach, and it enters into his small intestine here. The ayahuasca vine kind of knocks out the metabolism, it knocks out the monoamine oxidase inhibitor, so that's gone now. That's good. That'll kind of break through the body's defense mechanisms. And now you have the chacruna that becomes bioavailable, and we reach our visionary state here. So that's kind of how it's obviously a very kind of reductionist or perhaps a rudimentary or crude kind of way of understanding ayahuasca is an incredibly complex drug or medicine. But in a nutshell, this is kind of how we think it's working. So there's a few different types of monoamine oxidase inhibition or monoamine oxidase inhibitors out there. And the reversible ones are the ones that are in ayahuasca. These are the ones from the vine, the beta-carbolines or the hormonal alkaloids. And then there's irreversible ones, the pharmaceutical ones. So I think a lot of the recommendations, that at least that I've read about how long to avoid things with ayahuasca, come from what we know about the pharmaceutical monoamine oxidase inhibitors. And there's a couple different ways that a drug can block one of these metabolic machines like monoamine oxidase, right? It can block it temporarily, like it kind of go in there, like a key might fit into a lock, and then it can come out of the lock, right? And that lock is free to have another key inserted into it. So the key in this case would be something like serotonin, norepinephrine, dopamine. That's what's going to go into that key normally. Whereas the pharma ones are irreversible inhibitors. So it's basically like they're a key that gets stuck in the lock, and then the key gets busted off inside of the lock, and your body actually has to make an entirely new metabolic machine to replace it. And that takes about 2 weeks. So you hear a lot of like, oh, you should avoid it for 2 weeks before ayahuasca, or avoid something for 2 weeks after ayahuasca. And I think, I'm not 100% sure, but I think that a lot of it is coming from recommendations extrapolated from the pharmaceutical monoamine oxidase inhibitors. But kind of going back to our concept of half-life now, right? If we look at the half-life for the hormonal alkaloids, the reversible ones, they're really only 2 to 8 hours, so they're fairly short. So the amount of time that your body is in this sort of metabolically vulnerable state with this enzyme inhibited is much shorter with ayahuasca than it would be with one of these pharmaceutical types of monoamine oxidase inhibitors. Okay, so the toxicity. What possible bad things could happen if you had your monoamine oxidase inhibited and you had the wrong foods or the wrong types of drugs? Well, for food, you could get this thing called the cheese reaction, and this was named this reaction because back in the 50s, when they had these irreversible pharmaceutical monoamine oxidase inhibitors, people that tended to eat cheese while taking it would stroke out. They would have really, really high blood pressures and suffer a stroke or some type of adverse cardiovascular outcome. And they found that smelly cheeses, aged cheeses, have this amino acid called tyramine in it, and tyramine is also broken down by monoamine oxidase. So again, now we're talking about the natural defense. The amino acid tyramine is coming in and it normally gets degraded, but when it doesn't get degraded, it's actually able to enter the circulation and causes your blood pressure to go way, way up. So fermented things, it's not just limited to smelly cheeses, old meats, your miso, your soy, tofu, things like that. Anything that's aged really or fermented, even overripe fruits could potentially have a little bit of tyramine in them, are potential foods that could cause this if you combined it with a monoamine oxidase inhibitor. And there'll be a slide in a couple that we kind of walk through what those foods are a little bit more in depth. But for the moment with drugs, now the toxicity is something different. So with food, it was like we were worried about really, really high blood pressures and this cheese reaction. With the drugs, it's more of a serotonin syndrome, or basically serotonin overload, serotonin toxicity, you might hear it get called. And this happens because you're unable to degrade those neurotransmitters. You can't get rid of serotonin especially, but also norepinephrine and dopamine. So if you now combine some other drug that potentiates one of those neurotransmitters, and most often it's serotonin, then you can end up with a really kind of severe toxidrome where you have unstable vital signs, which means very, very high or very, very low blood pressures, very, very high or low heart rates or respiratory rates, things like that. Usually have like a lot of rigidity in the muscles. You could actually have some convulsions. They're usually hyperthermic or have some type of fever, and then some hyper-responsive types of reflexes. So that was scary. Let's talk about how to make it not scary. How do we avoid ayahuasca-associated toxicity? Dieta! Yes! So we just don't eat that stuff or take those drugs with ayahuasca, and we're cool. So in the context of this talk, because I'm not covering all of Dieta here, I'm really kind of limiting to what I know as a pharmacist that's going to be physiologically dangerous, right? So there may be other things that your shaman recommends, or he may recommend longer periods of time when I'm talking here. I would advocate to do exactly what your shaman says, unless it's eat the foods and take the drugs that I'm telling you not to. But besides those things, I would say, follow them because they've been doing it and they may know of more energetic interactions or things that aren't necessarily physiologically based that I'm aware of. So I do think that they have some good advice. And there are also a lot of other reasons and benefits of doing a dieta besides, avoiding some type of toxic reaction with ayahuasca, right? Spiritual preparation and focus, I think, is a really important piece of this type of work. Resensitization. So we live in this super hyper-stimulated world where there's screens and lights and MSG and salt and red hot peppers and all sorts of stuff all over the place. And when you're bombarding your senses all the time, the body is so smart, it will start to downregulate those senses because it wants to go back to a balance. It wants to go back to an equilibrium. So by kind of stopping some of these really hypersensitizing types of stimuli, you actually kind of resensitize or heighten the senses in your body. Habit disruption, so a lot of the time we're trying to break a certain habit with ayahuasca, right? So, we go through our day and we wake up and the ego's like, I gotta have a coffee, and then you get to work and the ego's like, I want a Snickers bar, even if it's just a fun-sized one. And then at lunch, it's like, okay, now I want that bag of salty whatever, and on and on throughout your day, right? And then there's also tradition, right? There's so much beautiful culture and tradition that surrounds ayahuasca use, and it's just so lovely to honor that. So what kind of foods and drinks was I talking about? So these are the tyramine containing foods and drinks. Again, you know, it's pretty much aged things, so aged cheeses, any cheese that smells. You know, I think most dietas say just avoid dairy, like period, but you know, probably some type of non-smelly cheese, at least physiologically, I think would be maybe okay. Stuff like, again, fermented, so like sauerkraut. On the maybe more hippie side of things, we've got our kombucha over here. You know, that concentrated yeast extract, that's a pretty good one. So it's a bummer that that's on there. You know, overripe fruits, I think is, there's probably a little bit of tyramine in there, but you know, in ceremony, if you want to eat a banana, if you want to eat an avocado, that's been done by a lot of people I've seen. No one's had anything bad happen to them yet. And then kind of one that's sort of an outlier, right, that I haven't really talked about is caffeine. And you know, for people that are taking pharmaceutical monoamine oxidase inhibitors, we just say to like really moderate it, right? Really just don't do too much of it, right? So don't have, you know, 2 venti frappuccinos or whatever. You know, just maybe a cup of tea is all right, but you know, just kind of in moderation with that one. And again, like I'll kind of go back to my email at the beginning. So if you know, I see people taking pictures, and if you want me to like email you the slide decks and then you just have it, I can do that for people as well.
We can post the slides afterwards as well.
Yeah, or Ashley can just post the slides. How about that? But you can still email me. I'm inviting that. So how long do you have to wait for food? Well, tyramine has a very short half-life, about 30 minutes. So 4 or 5 half-lives is like literally 2.5 hours. And if someone was starting a pharmaceutical MAOI, then the instruction would be to start the tyramine-free diet at the time you start taking the drug. So if you stop eating tyramine, really, I don't know, 6 hours, I'm recommending 24 in this talk, but just to be extra super duper safe. But you know, really I don't know that the tyramine is that big of a deal as long as you're not having it while you're like actually acutely intoxicated with ayahuasca. And again, I'm sorry I used that word intoxicated. Sorry. The harmful alkaloids have a half-life of 2 to 8 hours. So again, they should be completely eliminated, probably just over 24 hours, but kind of 48 hours. That individual metabolism could be variable. Maybe someone a little bit older had 2 cups this time and things like that. So I'm trying to build a little bit of a buffer in here for extra safety. So my recommendation here would be, you know, before ayahuasca, at 24-hour minimum, avoid after. You know, probably 48 hours is fine, but you know, 72 hours is extra safe. Okay, so the drug interactions are a little bit more complicated as far as they're not really well understood. You know, we know about drug interactions from the pharmaceutical monoamine oxidase inhibitors. That's been really well studied over the years, but there's not, you know, tons of great drug interaction studies with ayahuasca. But there have been some case reports where people get harmed. And the circumstances around this is usually really unclear. So it's very hard to attribute whatever happened to ayahuasca. But there was one case in particular in which they suspect that the person was at an ayahuasca ceremony. The ceremony concluded, they smoked 5-MeO-DMT, and that person didn't make it. And the coroner ruled that it was a serotonin toxicity, and 5-MeO-DMT isn't found in ayahuasca usually, unless someone does something that kind of spikes it or something. So they kind of think that this person may have kind of ingested or smoked 5-MeO-DMT right at the end of the ayahuasca ceremony, and this was just kind of too much because there was monoamine oxidase inhibitors on board. Now, there's certainly plenty of psychonauts out there that have things like Pharmacology, like Jonathan Ott is a great read if you're interested in that kind of thing. It's not what I'm going to advocate because I'm about safety rather than being super psychonautic with this group in this talk tonight. But, you know, depending on the person, maybe. Drugs that potentiate serotonin, norepinephrine, and dopamine likely present the highest risk. There's a lot of those, so you know, just ask somebody, and they range from everything from just things that you get over the counter for cough and colds to a lot of your prescription types of medicines. potentially supplements too, potentially other herbs or plant supplements. So, when in doubt, if you can, just avoid it. That's always a good way to go if you can. But, if you need it, if it's providing ongoing benefit to you, then, you can probably just ask and find out. And then, what we're talking about is really like neurotransmitter-based interactions, but there's probably other ones. Monoamine oxidase inhibitors are known to give what they call orthostasis, or basically it's a low blood pressure when you go from like laying to sitting or sitting to standing, and it can make you really, really dizzy. So you can imagine perhaps somebody that is already on a blood pressure medication and now has some ayahuasca on board too, and they get up and faint or something like that. So there's probably some other interactions, but really the most toxic ones are going to be with the pharmaceutical drugs, I think. So this is kind of your, I don't know, this is not an all-inclusive list. This is just kind of what came to me. A lot of the psychotropic or psychiatric drugs are probably a no-go. Things like herbs like St. John's wort is also pretty serotonergic. Your migraine medications are serotonergic. Even some of your like anti-nausea or anti-emesis, means anti-throwing up, basically anti-vomiting meds can be. I mentioned the cough and cold, so your pseudoephedrine or dextromethorphans and Robitussin. Weight loss supplements almost invariably have some type of amphetamine-related phenylethylamine stimulant in it, even the ones that say herbal things, like when you actually go and test them, they usually find some type of stimulant in them. Pain meds, methadone or tramadol, and things like stimulants like caffeine or cocaine. Even some Parkinson's drugs, and then I think this is kind of where it gets a little bit murkier, perhaps, as far as some recreational psychonauts may have put these combinations together, but again, for your standard person that wants to have a spiritual healing ceremony over the weekend, it's not really a combination that I would advocate to do, and probably would recommend against it if you ask me. So how long to avoid it? Well, it really depends on the drug, right? Because every drug's a little bit different. So what can we do? We can use our rule of thumb. We can use the half-life. We can say, okay, what's the half-life of this particular drug that I'm taking or someone else is taking, and then multiply that by 5, and that should give us an approximate kind of amount of time to wait before ingesting ayahuasca. So again, if a drug has a half-life of 24 hours or 1 day, then 4 or 5 half-lives would be 4 or 5 days, and so on and so forth. I did mention the exceptions earlier, so some drugs kind of have active metabolites. So we've got fluoxetine or Prozac. It's a serotonin-based type of antidepressant. It has a half-life of 4 to 6 days normally, right? But then it gets metabolized to this drug norfluoxetine. It's also serotonergic, that has a half-life of like 16 days. So the recommendation with pharmaceutical MAOIs would be to stop something like fluoxetine or Prozac at least 6 weeks before starting an MAOI. So it really does depend on what you're on, as far as, it could be as little as a couple of days, or it could be as long as almost a few months. All right, so let's put all this together now. That was a lot of information, and this is our weekend ayahuasca ceremony. So we've got our Thursday over here, Friday, Saturday, Sunday, and then our kind of post-ceremony days, time on this, I guess we'll call it an x-axis. So, at least 5 half-lives of the drug before the ceremony. You want to discontinue whatever you're taking that could be potentially interacting. About 24 hours before, you can start avoiding tyramine-containing foods. I mean, if your shaman's recommended 5 or 7 days, follow that. When you're actually taking the medicine, this is when your monoamine oxidase is inhibited, and this is the highest risk type of period. So your post-ceremony days, yeah, there's probably some risk here, but the amount of this drug that you have in your body is a lot less than, Friday or Saturday night when, you're flying. And then after a couple days after the ceremony, 2 or 3 days, it's probably okay to resume your food or drugs unless you don't need them anymore. And that's a pretty common effect from ayahuasca. All right. So we've kind of gone through our interactions, we've talked about how to manage the risks. So let's talk a little bit in the end about spiritual pharmacology now. So spirituality and mental health is sort of interesting. It does seem that high levels of spirituality appear to be protective against mental health conditions. It seems like lack of spirituality is recognized as a factor in the development of mental health conditions. So there does seem like there's some connection between us and kind of our overall sense of oneness with ourselves or with our surroundings that is beneficial for our mental health. Psychedelics are able to fairly reliably induce mystical experiences, and in psychedelic research they have this questionnaire. It's called the Mystical Experience Questionnaire, and has 4 different domains to it: sacredness of positive mood, unity of all things or oneness, ineffability, so like an inability to be able to really explain or accurately describe your experience, and then transcendence of time and space. And you can actually kind of fill out this questionnaire and quantify how mystical of a journey somebody had. And the interesting thing is that, for example, like the psilocybin and tobacco addiction types of studies, is that they find that how mystical the person experienced it with correlates better to their smoking quit rates than the amount of drug ingested itself. So it does seem that it's more about how did it make you feel rather than necessarily how much did you have. It seems like mystical experiences increase spirituality in both the short and the long term. Definitely the short term, and I think the longer term is kind of where our kind of post-ceremony or integration work comes in, and I will mention that a little bit more in a moment. Other possible beneficial effects of psychedelics, so I don't think it's just limited to like, okay, the only way that you can feel better or improve yourself with a psychedelic is to have a mystical experience. You know, certainly that's a big part of it, but increased empathy and insight could be a potential lesson that a psychedelic shows you without necessarily going to this place of oneness, right? Facilitation of trauma processing, immunomodulation. This is super interesting that psychedelic drugs seem to be able to really strongly modulate your body's immune system. And this is something that is really hot right now, looking at things like the gut-brain axis and depression and things like that. It really does seem like your immune system is playing a much larger role than your psychological well-being than we've ever really recognized before. And then physical healing as well. You know, I've had back pain and just had some kind of nerve release and felt a lot better from it. So I think that there is a potential for physical healing with psychedelics as well. All right, this slide is pretty crazy, so hold on. So psychedelics, including DMT, have really complicated mechanisms of action. For me, I think the summary is that it induces this neuronal state of really high plasticity. By plasticity, I mean it's kind of like, for a moment, you're sort of like a piece of putty that can be molded into something. And you obviously want to mold yourself into your highest being, but there's a potential to be molded in other ways as well. And I think I'll talk about that on the next slide, perhaps. There's a receptor, it's called the serotonin 2A receptor. And when you stimulate it, it usually produces a psychedelic effect. So all of our other friends here, psilocin, LSD, DOM, MDMA, mescaline, all are really strongly stimulating at the serotonin 2A receptor. And when we block this receptor with some other type of drug, and then give somebody LSD or give somebody MDMA or mescaline, they don't have a psychedelic experience. So it seems like activity at this receptor is really related to kind of a psychedelic or maybe mystical type of experience. At least when we're talking about these type of drugs. I mean, there's other drugs like ketamine or PCP that can give you a psychedelic type of effect that works through some other mechanism, but at least these ones here, the ones that Shulgin writes about in People and Teakle are mostly serotonin 2A type of psychedelic drugs. I kind of mentioned the immune system already, and DMT is not limited to this serotonin 2A receptor. It binds to a ton of other types of serotonin receptors. It also binds to glutamate. These are some interesting ones, especially the sigma-1 has gotten a lot of research in Alzheimer's disease lately. And then gene transcription factor. So this is kind of cool in that you have these proteins that basically turn on sets of genes. So DMT might make one of these things transcribe, I don't know, 10, 100, 1,000 genes. So now you have, whatever number of other proteins that then can do some other thing. So it really speaks to these drugs have effects that last a long time after the drugs actually left your body because it's turned on other genes, it's transcribed or made other proteins available inside the cell that can continue to do other things long after the drugs actually left your system. All right, I couldn't get through this talk without putting a picture of the neurons and the synapse, because I'm sure that's probably maybe what most people thought they were going to see when they came tonight. So we have our serotonin is abbreviated 5-HT a lot. It stands for 5-hydroxytryptamine. And then it's made from our friend tryptophan, so sometimes you have people taking like 5-HTP supplements and things after a really good night of rolling on MDMA or something to kind of replenish their serotonin stores. And basically what is shown here is that it gets released into the space between your neurons, and it can bind with these receptors on a different neuron, and the signal kind of continues. We have our friend DMT here. He can also bind to these signals, or she, the madre, can also bind to these signals. But we also have our friend monoamine oxidase, right? So this guy is here breaking things down. And the way neurons really kind of work is that they're mostly electrical energy, so things are coming down here electrically, and then when it gets to here, there's some calcium that comes in, tells this to release here, and then this is a chemical message now, and then when it binds to this, now it keeps going as an electrical message. So it's basically, electrical, chemical, electrical is how your neurons communicate with each other. So, I talked about, how does DMT get into your brain? Well, it inhibits the monoamine oxidase in your liver. That is true, but it also inhibits the monoamine oxidase here in your brain, in your neurons and in your synapse. So I think this is where some of the risk comes in as far as, well, if you just drank a cup of ayahuasca, probably smoking 5-MeO at this point is going to be really hard to get rid of because your metabolic enzymes inside your brain are also inhibited. It's not just in your liver or small intestine. All right, so let's get back to spirituality and mental health here. We know that lots of spiritual type interventions tend to increase mental health. So we have mindfulness and meditation, things like gratitude or prayer seem to work for some people. And then we have, psychedelic assisted psychotherapy is kind of on the research side of things, but also ceremonial psychedelic use. And some spiritual beliefs, I think, actually can be not so good for your mental health. I mean, if you have certain spiritual beliefs that you tell to perhaps a non-spiritual believing type of provider, there could be some misunderstanding there, there could be pathologizing you, which is not good. Some religions have punitive images of spirits, so, not to bash on anyone, but like things like Catholicism, it's like, okay, if you do this, you're gonna go to hell, and I've met a few people, even with ayahuasca, that, if I eat this food 3 days before the ceremony, she's gonna punish me. So, this idea that there's going to be some type of sledgehammer that happens if you, violate the rules or something. And then this is an interesting one that I've actually been contemplating a lot lately is if you have a mystical experience and it's truly ineffable, if you truly can't describe it in words, then why are so many people trying to describe it in words afterwards? And what does that do? What does that do when your ego mind takes your vision, put it into words, and then you keep retelling the story over and over again? It's probably getting farther and farther away from what your actual vision was, and more towards some story that now it's a fixed belief. And if that fixed belief serves you and makes you a better person, fantastic. But I'm not convinced that that's the case 100% of the time. So I think really this speaks to what I would like to kind of underscore here is that the care and expertise is needed to guide participants appropriately. And this, involves preparation with your Dieta, it involves support in the experience itself, and it involves aftercare or integration. So this kind of longer, open-ended type of process where you're taking your vision and maybe working with somebody like a psychedelic integration coach that is going to kind of help you process this vision and turn it into something that is beneficial for your life and not necessarily a fixed story that doesn't lead anywhere or some other type of problem. You have your ego completely wiped away, you don't know who you are anymore, you need somebody there to be able to guide you through that process of like, yes, who is the new you? Like who are you now? So adverse psychological reactions, not that common. Generally it produces beneficial psychological effects, but not always. There's, some case reports of people that have kind of persistent psychotic types of reactions, or maybe they were predisposed or had bipolar disorder and they become manic afterwards. And then, if you really don't have good support in your experience or very good aftercare, ayahuasca can be a fairly scary experience sometimes. So I think that there's even a possibility of, viewing this experience as a trauma, especially when you don't have good experience, support, and aftercare. So does ayahuasca cause psychosis? No, probably not. I don't think so. And UDV doesn't think so either. They've kind of looked at the rates of schizophrenia or psychotic disorders in teenagers or young adults that drink with UDV. UDV is a N-N-Dimethyltryptamine ayahuasca drinking church, if you're not familiar with them. And what they found is that there's no difference in the rates of those youth or adolescents that develop something like schizophrenia compared to anyone in the general population. In fact, it's a little bit less. So it doesn't necessarily seem like ayahuasca causes psychosis. That being said, people that have a history of schizophrenia, people that have a history of bipolar disorder, they wouldn't be prime candidates for using this type of medicine in my opinion. So recent research, we're getting close to the end here. I'm not a neuroscientist, so I'm not going to kind of talk about this too much, but there's this sort of self-referential part of your brain called the default mode network. We kind of think it's the part of the brain that maybe constructs your sense of identity. It seems like the activity in your default network gets way decreased with psychedelics, and this is probably, again, related to that mechanism of having maybe a mystical experience, this openness, this oneness, this connectedness with all things. You have to get yourself out of the way to have that type of feeling or have that type of experience. But default mode network activity, when it's hyperactive, is associated with all sorts of psychiatric conditions, whether it's depression or anxiety, substance use disorders, ADHD, even schizophrenia has like this component of probably, hyperactivity in some regions, and dysregulation would be the best word, I think. There's been a couple small clinical studies for depression or substance use disorders. Obviously, the beneficial anecdotes of ayahuasca kind of extend way beyond this into PTSD and all sorts of conditions, really.
Did you say it helps ADHD?
Would I say it helps ADHD? Potentially. I'm not sure. I don't have a clinical study to point to and say, like, yes, it does, but potentially. And then it doesn't really seem like there's an increase in psychiatric symptoms amongst healthy ayahuasca drinkers. It actually seems like adopting preventative health behaviors is pretty common. So they change their diet, they exercise more, they have better relationships with their friends and family, etc. And then when they study people that use ayahuasca long term, it seems like the personality trait that they notice that increases most is this openness. So this idea of being more open is really common. And I think this study was kind of a brain imaging study that looked at people that drank ayahuasca every 2 weeks for 2 years. So they had 50-something drinks in this period of time, and they take a picture of the brain at baseline and then a picture later, and kind of see these differences and correlate it with these personality tests that they gave them. So summary and conclusions. We're wrapping up here. We're getting very close to question time. So ayahuasca is safe when participants are screened appropriately, when interacting food and drugs are avoided, when the participant prepares adequately, when they enter a ceremonial container that is trusted and secure, and they integrate their experience. That is pretty clear to me, but there's a lot of pieces to that too, right? So we really have to make sure that we're doing this with very high integrity. Food and drug interactions are not very well understood, but we can utilize our pharmacology and we can extrapolate risks from the pharmaceutical MAOIs as a reasonable approach to doing this. And I think it's actually really reasonable because the pharmaceutical MAOIs probably have a much higher risk of dangerous and bad things happening to you than ayahuasca. So if you're extrapolating the risk from that, you're kind of beyond safe or probably even what you need to, but given that we don't have a lot of great data, as someone that's giving a talk to a public group, it seems like, yeah, well, let's err on the side of safety. And then the science of spirituality and drug-induced mystical experiences is growing rapidly. It's collapsing long-standing dualistic tensions between the disciplines, and many people suffering psychologically may be able to benefit from a drug-induced mystical experience. So with that, I'm done with the talk, and I'm happy to take any questions that the audience may have. Yes, tell her.
So I have done a lot of exploration of genetic polymorphisms, like single-type polymorphisms, and a couple of them that are relevant to this that I'm curious about the relationship of are the MAOA and MAZ mutations. Are you familiar with what I'm talking about? Okay, so here's my question. The methylation community doesn't seem to know how to answer this. If you have an MAOA or MAOB mutation that makes you less able to clear catecholamines, slower in terms of clearing catecholamines, is that like having an inherent or inborn or whatever intrinsic MAO inhibitor inside your body, or is it the opposite of that? Like in other words, which direction would it push you in?
Well, I think it's difficult to predict. So I think you're right in thinking about it that, okay, so Telly's question is basically, okay, I've talked about monoamine oxidase today, right? But there's actually two different types of monoamine oxidase. There's A and B. And A is the one that's inhibited mostly, is the one that has most of the risk associated with it. MAOB is sort of limited to metabolizing more dopamine. It doesn't necessarily do much with serotonin and norepinephrine. But your question is that, okay, if I had some type of mutation in my monoamine oxidase and it wasn't working right, then it would seem like you would have more neurotransmitters around. You'd have more serotonin, you'd have more norepinephrine, you'd have more dopamine. So maybe that's more like a natural antidepressant, right? Maybe this mutation has some type of natural antidepressant activity. And logically, that sounds right, but I can't say for sure that that's true because the body is really, really smart. And what it will do probably is it will decrease the amount of receptors that are available for those neurotransmitters on the cell, on the neuron itself. It will say, whoa, there's way too much serotonin around. Let me just get rid of some of these receptors to make the signal normal again. So, I don't really know which way it would end up going. My guess is you would probably have a little bit more.
So it'd be like having a little bit of an MAO inhibitor inside.
Yeah, that's my guess, but
so in other words,
it's a guess.
That would imply that you would potentially have a stronger reaction to ayahuasca, right?
I think that's a fair statement.
Okay.
It'd be interesting, because if it was really a mutation that was dangerous, right, it would probably get weeded out over time because people would eat pteramine-containing foods and have a bad reaction and not be able to reproduce with other human beings because they had a bad reaction. And so you think that mutation would become less and less over time. But if that mutation is fairly prevalent and common in the population, then it suggests that there's actually some selective advantage to it. And if you're a happier person, if you're slightly happier, law of attraction, maybe that's why something like that would actually be advantageous. Probably just depends on how severe a mutation. Right?
Can I ask you a semi-related question?
Yeah.
Not exactly related, but it might be. So my response to ayahuasca is really unusual, and I have not figured out why this happens. The first cup, I pretty much don't feel anything. Everybody else is coming up. I'm sitting there like feeling miserable. So an hour later, I'll take a second cup, and I'm not really feeling much of anything. Everybody else is like totally in their thing. And then like another hour later, the shaman is, convinced that no, I'm not feeling anything. So they'll give me like another half cup or something like that. And I wait another hour, and then about 3.5 hours in, like whoosh, all of a sudden I'm like really strongly feeling it. But like, and everybody else is like starting to come down.
Yeah.
And it's terrible timing because it's like they're all completely done and I'm just getting there, do you have any idea what could be some causes of that? Number one, it takes forever to kick in, and number two, it takes a lot of it to actually have an impact.
So different people have different amounts of monoamine oxidase inhibitor in their small intestine and liver. And the beta carbolines, right, the harmful alkaloids get metabolized in your liver by something called, it's an enzyme called CYP2D6. Some people have really revved up CYP2D6s that really just burn through stuff, and some people don't. So my guess, this is pure speculation here, that you have a lot of monoamine oxidase in your stomach, and that you have a lot of metabolism going on as well. So when you take that first cup, it just gets metabolized. When you take the second cup, you're getting closer, and it's the third cup that finally enough enzyme is inhibited to make it bioavailable. I've noticed for me personally, I don't necessarily have, I don't have like a meta, first cup works, but I've noticed that the second cup, if I drink 1 ounce the first one, a quarter to a half an ounce, third of an ounce for the second one is just as strong as the first one. And I suspect that it's just as strong because I've already had all my enzyme inhibited from the first one. So I think different people need different amounts to initially get that enzyme inhibited. And what about the second night? Is the second night the same, or is the second night you need less?
I'm not done.
Yeah. Because I've noticed too, like the second night, people usually need a little bit less. And my guess is that there's some residual inhibition of their monoamine oxidase from the previous night.
So what you're
But I'm just guessing. I don't know that, right? Yeah.
Okay. But what that is, that's the opposite of what would be implied by an MAOA mutation, right? Like what we were talking about, that would be kind of more like that.
Well, I mean, mutations can go either way. You have a mutation that makes things work really good, maybe. Like maybe it's working better. Maybe it's like this mutation is actually increasing its function.
The mutation where you have difficulty breaking down catecholamines.
Right.
But what you're describing about like you've got a lot of MAOA, that would be like the opposite of that, right?
Right. So the beta carbolin inhibits MAOA, but it's not broken down by MAOA. It's broken down by something else. It's broken down by this enzyme in your liver called CYP2D6. So even if you had not a very good MAOA, you had a really revved up CYP2D6 enzyme, it could get rid of all the beta carbolin or harmful alkaloids. Any other questions? Yes.
Related to doing 1 night versus 2 nights, do you recommend one or the other, or is that too so much better? Kind of based on what you were just saying.
I think a lot of times when you come on the first night, it depends, but usually it's kind of like there's a lot of stuff going on, you've just traveled, maybe you're a little stressed, et cetera, you're nervous, you're unsure, you've never seen half these people before in your life. So I think there's just some maybe discomfort that comes along with that makes the first night more challenging for some people, whereas a lot of people find the second night to be more blissful and open and maybe perhaps more mystical, but that's a generalization, and I've definitely had experiences where first night's really blissful, it's not so much. So what do I recommend? Yeah, I think a couple nights is better than one. I would much rather go 2 nights in a row than 1 night for sure. But does it have to be done that way? No. I mean, if you told me like, well, Ben, I've done 3 2-night ceremonies, and the second night's been horrible for me every time. And I say, okay, well, why don't you try one night this time, right? But if you're someone that's never done it before, then I would say go with the 2 nights, because the first night you could get challenged or scared or something and walk away with this conception of the medicine that is just kind of inaccurate compared to what's really possible as far as an experience. Charles, because I like you.
I like you.
And I know your name.
Well, I just want to thank you first of all, because I've experienced this quite a few times, but I don't often think in pharmacological terms.
Yeah.
So it's nice to flow through the whole, what are these things and what are they doing?
Yeah.
And then my more specific question is with serotonin 2. And so if someone were having an extraordinarily difficult time, say, during the experience, would there be the potential of creating some sort of serotonin 2 agonist or something in the future that would help someone immediately come down from early?
It's an interesting question. I mean, all of the atypical antipsychotics, they block dopamine and they block serotonin 2A receptors. So, would I want to give an antipsychotic to someone on ayahuasca? No, I really wouldn't. I would not want to put the brakes on that type of experience, because I think that could introduce a lot more potential for harm than it would do good, as far as, okay, maybe it would stop their experience in the short term, but I don't know if weeks later that's really was the best move for them at that time.
Right.
They have a new drug. It's for hallucinations from Parkinson's disease. It is purely a serotonin 2-way drug. It's still categorized as an antipsychotic because it's to treat psychosis, but it doesn't block dopamine, so that's a little bit more specific. But would I want to give that? Do I think that's a good strategy? It might be best to let it ride it out. Joel.
So as with DMT, when smoking DMT, or the body actually spends energy spreading across the brain through the blood areas. Has there ever been any similar effect found with ingesting ayahuasca, where the body expends energy to kind of get it where it might not go? You've heard of it?
You say the question again?
So when DMT, N-N-Dimethyltryptamine is smoked, also found, the body apparently expends energy to spread it across the brain, and I cannot remember technically how.
Like it gets transported there?
Yes.
Yeah, okay.
Yes. When ingested, does the body have any similar reaction where it actually shows that it works to kind of promote it, like almost like, you feel like the body's like, yes, get this in there.
Yeah, so I think what you're referring to with the smoked DMT is like the blood-brain barrier.
Yes.
You have this kind of barrier that separates the rest of your body from the blood in your brain, because the body recognizes that the brain is very important and sensitive, and it wants to really make sure it knows what's going in there. And there's a couple ways that things kind of get across. The most common is that they're really fatty substances, and they're able to go across cell membranes. The other ways are that it looks like a neurotransmitter. So DMT looks very much like serotonin, and serotonin is something that the brain needs. So the brain will put transporters and actually expend energy to bring these things into the brain, because it's like, these are the building blocks for the chemical reactions that we need to create. So the harmful alkaloids, I would guess that they get into the brain because they're fatty enough to just go through. My guess would be that they're not actively transported across. Usually the only things that are transported across are things that look a lot like neurotransmitters or amino acids that are building blocks for neurotransmitters. So as far as like other parts of the body, yeah, I'm not too sure. I mean, serotonin nerves aren't just in your brain, right? Like 95% of them are in your stomach or in your gut. And there's certainly plenty of other nerves in other parts of the body. So, are there transporters that put these things into other parts of your body? Probably. But the thing is that when you're talking about psychoactive drugs, they're usually fattier than normal drugs, because they have to get into the brain to work. And unless they have a transporter, which is pretty rare actually, it's pretty rare, there's not too many drugs that actually get transported into the brain. They have to be fatty. So, yeah, my guess is that it does kind of seep into most of the places in your body, because every cell membrane is completely fat. Yes?
You mentioned gene transcription being activated from DMT.
Yeah.
Can you speak more about that?
I don't know which transcription factors. There's a citation on the slide though. I got it from this great paper, Neuropharmacology of DMT, and they definitely kind of talked about it a little bit more in that section. But off the top of my head, like which transcription factors and what genes it turns on, I couldn't tell you.
Yeah.
Yes.
I don't know if you know much about NTHFR gene, how sort of plastic
Methylfolate reductase.
where you can't detox it as well as normal people, so your glutathione isn't just as much. I wonder if that can make like the vitamin ADHD or the other drugs like Sane and Stellar longer to have effect, to have like experience later.
Possibly. So the gene that you're talking about is this, it's glutathione. So glutathione is something that a lot of these enzymes use as something that makes them work. It's like that's what vitamins are, is that they're substances that these metabolic machines need to function. So if you don't have glutathione around, maybe you don't have as much metabolic activity, which could extend the duration, but specifically, was it MTHFR? I'm not really sure. I don't really have a.
Do you think it'd be good to take glutathione before or after that kind of experience to help clear stuff in the body, or
I wouldn't do it just prophylactically. I mean, if you had some like genetic. Prophylactically means like to avoid a problem before you even have it. So, like a condom is a prophylactic way of preventing pregnancy. It's like you're putting something on to prevent an event happening before it's happened. So, if you didn't know you had this deficiency and you had an experience and it lasted a normal amount of time for you, I wouldn't just start taking an extra supplement just to like see or something like that. For me personally, if it lasted, that sounds like great. Yeah. All right. More bang for your buck, huh? But yeah. So I don't know. If you had some very specific information about yourself and you knew that was what was going on, then yeah, I think it might be worth a try because I don't think glutathione is very toxic. It's water soluble. You're just going to pee it out. It doesn't interact with stuff. So it's probably okay. But I don't really advocate people just trying supplements on the off chance that that's there. I like them to kind of, have more of a reasonable suspicion at least that, this is actually a problem that relates to me before I try and find a solution for it. Yeah. Last question. Oh, man. I was looking at her. I'll answer yours after. Hey.
The purge. I've had this really interesting where I'll either not purge at all, or it is so extreme that I pass out. I've passed out 5 times.
Wow. Like just laying down, or?
No, as in like I wake up afterwards, like out.
But were you like trying to stand up when you were doing this?
No, I'll be sitting.
You were sitting, okay.
And then the other, 50%, I actually don't even purge at all. And everything is the same. I have a similar system like yours. I don't drink a lot, but I know that it comes on much later.
Well, I mean, the vine itself, I was talking to Sel about this earlier, probably has things in it besides monoamine oxidase inhibitors that can make you nauseous. So maybe it depends on the batch of ayahuasca. Maybe one time you ingested some 80-year-old grandfather vine from deep in the jungle, and maybe one time you ingested some little new sprouter vine that was grown on some farm or something. I don't know.
It's sometimes one night and then the next night, and it's the same batch.
One thing that I didn't say about ayahuasca yet, but it is the weirdest medicine as far as individual effects go.
Can I tell you one more fact that
Yeah.
it on me the very first time I drank, and I have it all the time now, or I drink like and stuff. When I drink, I immediately, like I know it's coming on, that I start feeling everything expanding, like inside my brain, everything starts expanding, right? And after the first time that I drank about a year ago, it materialized in that I can now, like when I'm sitting, it's like I have a muscle inside my brain, right, and expanded out. Is that a common thing?
You know, I haven't really, I mean, getting superpowers. Yeah. I mean, that's kind of that sounds like your special superpower. I'm not sure.
Well, it does create new neural pathways.
Right,
So that makes
yeah.
a lot of sense.
Yeah. I mean, is it common that, you know, most people have that happen to them afterwards, but is it wrong? No, I don't think so.
No, I'm just
Yeah.
curious what is like really weird, because it almost feels as if I'm a horse, like I can turn, you know how horses like turn their gears, I feel like I can turn presently, right?
Huh.
Like move it, like massage it, and I'm worried, what, like I try to understand physically what is happening, is that my brain
Yeah, I'm not entirely sure, but I mean, it does break down existing neurocircuits and allows new ones to form afterwards. So that's potentially why. But speaking of breaking neurocircuits and you know, forming new ones afterwards, I would like to hand the microphone over to my beautiful wife, Sherree. She's a psychedelic integration coach, and she's going to say a word or two about integration. And you know, you should listen because it's really important when you're using these medicines to follow up with some appropriate aftercare. So, Sherree.
Thank you, Dr. Malcolm. Was that fantastic or what? Thank you so much. So, as Ben mentioned in a couple of slides, that integration is a super important part of not just ayahuasca, but really any medicine work, because there's a saying that goes, the work begins when the ceremony ends. So what the medicines do is they point the finger towards that healing path that we need to take, and then once the ceremony is done, it's time to take action. And integration is all about taking all the insights and lessons that we received in the medicine or psychedelic realm and translating them into daily action steps to really make use of them in our daily life so we can grow and expand from them and really make really good use of all the healing that we received. So integration is a very important phase. As Ashley mentioned earlier, we currently live in a world where these medicines or these states are rather pathologized. There's not really a lot of room to talk about them. Altered states are deemed as, or can be deemed as even dangerous to our well-being. So an emerging field in psychology is called psychedelic integration. Now I personally studied psychedelic integration therapy when I studied psychology, and I'm a psychedelic integration coach. And I have different projects that I work on, one of them being inner space integration, which I co-founded with Ashley about a year ago. And in inner space integration, which is a community-based organization, we really aim to provide a very safe and confidential space for individuals who have partaken with medicine ceremonies, for them to come in and talk about their experiences and really process them and talk to other community members who have undergone through similar experiences and really come together in our healing and make sense of everything that they've been through without going to perhaps say a psychologist or a therapist that is not familiar with medicine and will pathologize them with various mental health disorders. So that's what we do at Inner Space Integration. We offer a few different types of services. One of them is the Psychedelic Integration Circles, which are currently held twice a month in Santa Monica, which I've been leading in the last 3 months. We have a few members here that are awesome members that come every time. I love you guys so much. And so these circles are open to absolutely everyone. They are donation-based, so you just come as you are. We would love to have you, and you just come and talk about your experiences and ask questions and learn more and connect with the community. So everyone is absolutely welcome. The next circle is going to be on Wednesday, April 5th, I think it is. And another event that we have with Inner Space is coming up actually this Thursday, a really cool workshop called Our Brains on Medicine, or Our Brain on Altered State. So we have Dr. Dario Nardi, who's a dear community member. He is a neuroscientist and teaches, I think, neurobiology at UCLA, and he does a lot of brain research. And he's actually going to bring a real live EEG machine and going to do a live demo on a person from the audience. He's going to give him a few tasks which I guess simulate the brain activity while on medicine, and he's going to show live what happens to our brains while we take psychedelic substances, which is super awesome and cool. So it's happening this Thursday, also in Venice at the Quest, which is not too far away from here, I think. Yeah, and on a personal note, aside from Inner Space, I also have my private integration practice, and one of my most absolutely loved projects and services that I offer is an integration group dedicated only for ayahuasca experiences. So individuals who are preparing to go into ceremony, or just came out of ceremony, or constantly going in and out of ceremony, which, in LA, it's pretty common. There are many circles happening in LA, and many people are coming in and out of ceremony constantly, so they're always like on a semi-high state from the medicine. So we have a group that meets every Monday evening here in Santa Monica, and we just talk and process all this incredible, profound experience that is the ayahuasca intelligence. And it's very useful in coming back to and grounding down to this default world, because those of you who've tried ayahuasca know that it can be completely mind-bending and can give you superpowers. And sometimes we come back to come Monday evening or Monday morning, it's really hard to get back to a normal state. So it really helps to come to the group and talk about it and ground down and chill out and check in with other people who did medicine that weekend, and even kind of see if you connected on the same realm, and that's kind of cool. So that happens every Monday, and we still have spaces in the group if anyone is interested. And another word about ayahuasca, I didn't tell you this quite yet, but I have a beautiful friend named Glennis that came from Peru recently. I was so lucky and blessed to meet her. She worked for a year at a center called Niue Rao, which, if those of you who know Dr. Joe Tafur, who will be coming to LA, I think, in a week or two to give a talk. So he was the medicinal director, the MD director, the director of that center. And anyhow, Glennis worked at that center, and now she's in LA, and Glennis and I will be leading a group to Peru in Thanksgiving. So a retreat to do medicine, which will include preparation and integration as part of our group. So we're super excited and stoked to offer it. If anyone is interested, just come and talk to us.